Welcome to the Gladden Longevity Podcast with Dr. Jeffrey Gladden, where our passion is helping you become an age hacker. On this show, we want to help you optimize your life energy, longevity, health, and human performance with impactful and actionable information by answering 4 questions. How good can we be? How do we make 100 the new 30? How do we live well beyond 120? And how do we live young for a lifetime? I'm Steve Reiter and Dr. Gladden. We just wrapped up with Lana Kerr, the founder and CEO of Lumisque. They use carbon dioxide to help rejuvenate skin. I've been on every single episode, and I've never heard of this treatment.
Yeah. I was just at a conference this past weekend, and we were talking about CO2. And it was intrarectal CO2.
Really?
For rejuvenation. And what we're talking about here is not that. What we're talking about here is something that's in a gel. It's CO2. And we'll talk about how this works. But the bottom line is it's one of the most potent things you can do to rejuvenate your face and rejuvenate your sex life. I think you're going to find this really fascinating, how this works for men and women to rejuvenate their sexuality, the tissue quality, erectile function for both men and women. Pretty nuts stuff. And you don't have to do it every day. It's the kind of thing you just do it periodically. So really fun conversation with Lana.
Yeah, she brought great energy. And in the Age Hackers Plus segment, you really went into depth about how important a healthy sex life is, how many people are living in sexless marriages, and how really important healthy sex is.
That's right. And Lana talks about her sex life too, which is interesting. So you'll want to hear this episode. Yeah.
For listeners that are interested in listening to that section, you can go check out Age Hackers Plus at agehackers.com. And there you can subscribe. You'll get our Age Hackers Plus segment. You'll get a whole bunch of other benefits that are there, agehackers.com.
Welcome, everybody, to this edition of the Gladden Longevity Podcast. I'm your host, Dr. Jeffrey Gladden, and I'm here with Steve Reiter today. Stephen, what's the latest?
Beautiful weekend up in Breckenridge, where I went to the International Snow Sculpture Competition. Okay. And it was really interesting, and bookended that with a whole bunch of cross-country skiing, that evening on Lake Dillon, that morning, a couple backcountry ones the day before at the Vail Nordic Center. And so my thighs were burning and sore for a couple days after that. How about you?
I spoke at a conference in Florida.
How'd that go?
They were doing sculptures in the sand, which is really cool. But it was great. Yeah, it was really great. We're talking about some rejuvenation technologies between linking together plasmapheresis, young plasma, and stem cells, and how powerful that can be when you kind of get that combination synchronized. So it was really interesting. Today, talking about rejuvenation, we're going to be talking about skin rejuvenation with Lana Kerr. Lana's joining us today to talk about several things that we haven't ever covered before on this show. So Lana, welcome to the program.
Oh, good to be here. Thanks for having me.
Yeah. So tell us a little bit about your journey here. I know that you got a business degree and you have a nutritional background, but you've branched out from there, right? You were doing some things with helping people with weight loss and then transitioned into skin. Tell us a little bit how you got to where you are today.
Yeah. So as you mentioned, I started off in accounting and finance, and then went into nutrition, opened weight loss clinics over 20 years ago. We primarily used HCG, which was controversial when we started. But really, I think the success of the program was based on the fact that we helped people to change their thinking around food, and we taught better habits so that when they lost the weight, they were able to maintain it. And so we've really had some great success with that. Then eventually went into med spa, and we just looking for something different. Just as HCG at the time was unique, just something different for skin health, we came upon carboxytherapy and just looked into it further. We found a gel delivery system, because carboxytherapy is very old. But
so let's talk about carboxy. I don't think the audience understands what carboxy is. So this is carbon dioxide that we're talking about, right? CO2. Yes. Something that's warming the planet, if you will. And so CO2. So we're not used to, when we breathe in, we're breathing in oxygen from the air. And then when we metabolize that oxygen to make energy, we exhale CO2, right? So we're
Correct.
blowing out CO2. So how is it that the CO2 is now therapeutic? Tell us about that. How's that working?
So when you take in CO2, the body has to almost recalibrate itself. So it rushes oxygen to the area, and it picks up the CO2 and drops off the oxygen. And that floods that area with it. So it's increasing vasodilation. It's increasing blood flow. It's increasing, cell
So
turnover.
this is interesting. This is interesting physiology, right? So when you exercise, of course, you're building up more CO2 in your muscles, right? Because you're making energy for the muscles to work. And so simultaneously, there's increased blood flow to bring in the oxygen, but also to remove the CO2. So what we're talking here is actually kind of tricking the body a little bit by just exposing tissue to high levels of CO2. Now the body's natural response to that is to bring in oxygen, right?
Exactly.
To kind of clear that out and get the tissues back to the right pH and give them the right amount of oxygen again. So it's an interesting technology. You're actually increasing oxygenation of the tissue and blood flow to the tissue, even though initially you're putting in CO2, which is the byproduct of oxygen utilization, right? So that's kind of interesting.
Yeah, we kind of compare it to a hyperbaric oxygen chamber type of thing, except that it's portable because it's a gel and it can be applied anywhere in the body. In fact, we've had a really, really, really good results with this particular plastic surgeon he does aggressive liposuction. He's the one who kind of started high def liposuction, Alfredo Hoyos, and he uses HBO. And he put it on one side of the body. He's done 50 patients with it, and just across the board, just dramatic improvement in healing, reduction in just, black and blues, just the recovery has been very nice. So we often compare it to a hyperbaric oxygen chamber. I think many people can relate to that.
Yeah. So when you oxygenate the tissue, you basically facilitate more healing, more energy production, which is really what's required for more healing. And so what you're doing, correct me if I'm wrong, is you're applying this gel to the area where the surgery was done, and it's probably decreasing scarring and accelerating the healing. Is that what's
Exactly.
happening?
Yes. In fact, also we've shown it as a standalone what it's doing for skin. So besides those two components that you mentioned, increasing hydration as well. We found 117% increase in hydration after just one application.
Is that from the gel or is that from the CO2?
I guess a combination, but even with just carboxytherapy, using just the needle with the CO2, they found that to be the case. So I guess all the nutrition in the blood, and blood is mostly water. So I think that's part of it. Yeah. But yes, just to talk about the healing aspect of it, we've done diabetic ulcer studies. And when we did our pilot study, we found that it can close a non-healing diabetic ulcer in as little as 8 days. We've done 15 to 20 patients, and the same thing. All of them recovered in a month.
What's interesting is you can do the same kind of thing with ozone. Like if you apply ozone or inject ozone or ozonated oils around a wound, it will heal much faster with no scarring. I've done that numerous times from some mountain bike crashes where I smashed my face up and some other stuff. But I think the common denominator here is that you're increasing blood flow into these areas, right? With ozone, you're creating an oxidative stress, which of course then the body's going to respond to. With CO2, a similar kind of scenario. With hyperbaric, a similar scenario, more oxygen to the tissues, accelerated healing, and accelerated energy production. So it seems like there's kind of a common denominator between these technologies in some way. I think the nice thing about what you're talking about is this sounds very portable. Like you can just take it with you. Is that correct?
Yes, correct. You can do it in the privacy of your home. So we started off with just skin health, for people who want to look good for an event, because you see the results almost immediately once you remove the gel. And so face and neck. Then we got into combination therapies, in terms of healing post laser or post radio frequency. Then we got into more wound healing. We've seen it help with cases of rosacea, eczema, because also it's cleaning the extracellular matrix, is removing inflammation and waste. So you're going to see just better recovery of the tissue. You're going to see healthier skin. And again, what is nice about it is painless. There's no pain involved, and you can do it in the privacy of your home.
Right. So how often does somebody apply this?
So if you're doing the face and the body, because we also have an application for the genitals, but for the face and body, you're looking at 6 within a first month is going to give you really nice numbers, really great results. And then you can maintain it with one treatment.
Let me interrupt you for a second.
Okay.
So 6, I'm thinking about a gel. So is this you're applying the gel to your face 6 times in a month?
Correct.
Or
Correct.
that's what you're saying. So
Yes.
It's not a daily thing. Okay.
No.
And then I assume you apply the gel and then you can just go about your business, or do you look like you've got Jell-O on your face?
You look like you have something like Jell-O on your face, but you're going to do it. It lasts for 45 minutes. So you keep it on for 45 minutes and then it peels off. So it peels off nicely, almost like in one thing. It peels off. So it's a nice application. In fact, I'll send you some this week so you can try it.
Yeah, send me some this week. I'd like to try it. I've always liked Jell-O. So, that's good. Okay, but you don't eat it afterwards. Just teasing, right? So, but okay. So you put this on 6 times in a month. That's pretty interesting because many things is kind of a daily or twice a day or something like that. So you're doing this essentially 6 times, so every 4 days or something, right? Every 4 or 5 days.
We've done it where we just kind of model what the clinical study did. They did 3 in the first week and then just 1 a week for the next 3 weeks. So that's it. And then the kind of results you're getting, I mean, really double-digit improvement in wrinkles, fine lines, elasticity.
Really?
Yes, hydration.
Okay.
I think elasticity is a big one because there's really nothing that does that.
Right. And so this must actually improve collagen formation then, I would think. Is that true?
Yes. Uh-huh.
Are there any supplements that you take in conjunction with this that also helps to augment it?
I'm sure there are. I'm sure there are, but we don't necessarily need it for that.
Amino acids. But you didn't do it with that, just on its own.
On its own.
Interesting. And was this developed for a cosmetic reason or for a medical, like clinical need reason, or how did that work?
For cosmetic. I mean, usually a lot of things that work with wound healing has an aesthetic benefit. So that's pretty much where we started.
So tell me about the skin on the rest of the body.
Yeah.
You know, there are people that go through weight loss routines and they end up with extra skin and some scarring, you know, from stretch marks and things like that. It could be related to childbirth, but it's also related to people, men and women, who've carried extra weight. Does this seem to have any impact on that at all?
I've seen, well, not very loose skin. I think you would need something else along with that. I've seen this particular doctor, in fact, send me some great pictures. They use it in combination with some type of radio frequency device with the CO2 lift and some really great results. But I think on just mild laxity, you'll definitely see a nice improvement in that. On the stomach, for instance, I mean, I've seen some women use it on their knees, you know, on their thighs, some nice, but for dramatic weight loss. So what's going on with Ozempic, I don't think, I mean, that's heavy skin. I wouldn't say that that's a perfect fit for that.
Got it. Okay. I was just curious what the limits of it might be. And then you commented on using it in the genital area. Is this for men and women, or is this for women only? Or
for men and women.
Okay, so what are we targeting here? Let's say in women, what are we? Is this intravaginal or extravaginal? Or
yeah,
what are we doing?
It's for the vulva vagina. So, for instance, for women, I think there's 2 components to even sexual wellness. You have the vulva, which has a clitoris, which is like an inverted penis, all that erectile tissue, and it really, for it to function correctly, it needs proper blood flow. And so the CO2 lift is, and I'll tell you the results of our last clinical study. So it's applied to the vulva, but also the vagina, which you know that's tissue in there. That skin is similar to what's under the eyes, is very thin, fragile, dry. So because of hormonal changes and stress and all of that, that for women, sex can be uncomfortable. They'll feel looser because it gets thinner. So they feel like there's looseness down there. And then on top of it, it can lead to painful sex. So the CO2 lift V, as well as stress incontinence, also can be related to atrophy. So the CO2 lift, we just completed our second double-blind clinical study, and we saw all the women that used the ultrasound gel, the placebo, showed no change in sexual function. All the women that used the CO2 lift showed significant change in arousal, desire, orgasm, lubrication.
Interesting.
And it's interesting, Dr. Gladden, because desire, I was kind of like, you think that with even the placebo, you would get an increase in desire. It just shows you how blood flow is really related to that. So, and then the stress incontinence was great. Bladder life improved significantly.
It's interesting.
Sleep, I don't know if it's because they're getting more sex or it's because they're not peeing peeing in the middle of the night, but it's great results on that.
This episode of the Gladden Longevity Podcast is brought to you by Mimio, a supplement designed to give people the benefits of fasting without having to fast.
Yeah, Mimio's research found that the human body produces a unique set of molecules during a 36-hour fast. And those molecules were responsible for activating many of the cellular health and longevity benefits of fasting.
With Mimio, you can get the cellular health and metabolic benefits of a 36-hour fast even during a meal, or you can use it to maximize the benefits of your shorter fasts with powerful boosts in mood, focus, energy, performance, recovery, and appetite control. Dr. Gladden, in the 2 years I've been working with you and the 5+ years I've been listening to the show, I've never heard you talk about something outside the Gladden Longevity line of products like I've heard you talk about Mimio. Why do you like it so much? Use it and make it a part of some of your presentations.
Yeah, we love it, quite honestly. I mean, the idea of Mimio being able to mimic fasting, we all know the benefits of fasting, is dramatic in and of itself. And even in the context of if you're eating, and if you're fasting, it even augments your fast that much more. But the interesting thing is that it also decreases things like neuroinflammation, it suppresses appetite, and it increases a very, very important biological process called reverse cholesterol transport. And that's critical for cardiovascular disease, for decreasing risk of dementia, cancer, et cetera. It's really, it's quite a fascinating product. I've really been kind of blown away by it.
As a way to help support this podcast and save money on your Mimio order, you can use the discount code GLADDEN10 to get 10% off your order at mimiohealth.com. That's that code again, mimiohealth.com. That code again, GLADDEN10 at mimiohealth.com.
Think of it as a way to unlock the power of your biology. There are young people that have vulvodynia, which is really painful intercourse related to issues with vaginal tissue, and it can be very disabling for younger people. I wonder if this would have an impact there for those folks. Were they part of your trial, or was it more people?
We used people who are from 40 and up. So that was kind of the thing. I think with younger people, like even suffering from that, or lichen, we've had great success with lichen, which affects women of all ages. But I think for vulvodynia, I think sometimes it's a lot mental. And I think the reason why we can be an effective therapy for that is because people are expecting sexual intercourse to be more comfortable, to be more pleasurable. So the mindset is a little different. I think there's been some conflicting things with that in terms of the mental outlook. So we have used it and we've had some success with that. I think another telling one is, as I mentioned, is the lichen sclerosis, biopsied lichen, which looks very different in so many different vulvas and in women. We've had really great success with that as well.
Talk to us a little bit about lichen. So I'm familiar with lichen in the oral lichen, right? You can have, it's like a patch, it's like a small area of infection. Same thing can be happen in the vulva and vagina. And what you're finding is that you're increasing with the CO2, I guess, increasing blood flow and actually able to clear the lichen. Is that what's happening?
Yes, and inflammation as well. So the inflammatory, anything with some type, we're getting rid of that. So as you know, it can present sometimes even in closure of the opening. So what we've seen, and I have some incredible pictures where you can see after you're talking about 9 applications, you can see that opening so they can actually have sexual intercourse. So we've done pilot studies for lichen. That's going to be our next study for that area with lichen sclerosis with the CO2 left.
Let's talk about women for a minute. When we think about women aging and we think about perimenopause, menopause, then vaginal dryness, lack of lubrication, decreased libido, and to your point, just as a male erection is a function of both nerves working properly and then the blood flow and the arterial flow being there to basically support an erection, the same thing is true in the clitoris, right? So the clitoris is basically fueled just like erectile tissue in a penis with blood flow coming in. So typically we would think about using, rebalancing somebody's hormones with regards to estrogen, progesterone, testosterone, DHEA, things like that too. And you can even use topical estrogen intravaginally to kind of improve lubrication. So it sounds like what's happening if someone is listening to this and they're in menopause or starting to notice some of these symptoms, we'd be saying, yes, go ahead and get your hormones balanced, but this could also be a very nice add-on, it sounds like, did you have people in menopause that you used this in and it was added on and,
Yes.
and really gave great benefit? Yeah.
Oh, definitely. For me, I would be an example of that I started on bioidenticals when I was about 45. I started noticing a difference in quality of sexual intercourse when I was 47. So even with my hormones balanced, it's just not the same. It's just not the same. It wasn't a problem with dryness either. But I can tell you something. The introduction of the CO2 Lift V, you kind of forget the level of lubrication you used to have when you're younger, because that's like you're opening the floodgates of heaven again. So it changed for me. So the quality of sex changed. Of course.
That's how Steve returns first. So we'll put parentheses on that. The floodgates of heaven. Okay. So that's very good.
Yeah. So I think, but to your point though, we have women who cannot take hormones. For instance, we have a lot of breast cancer survivors who after chemotherapy cannot take hormones or don't want to, who have benefited significantly from the CO2 Lift V.
So cool. Yeah, that's wonderful. Yeah, there are people for whom, and typically it's related to cancer. Hormones are just too risky for them on some level, especially if they have estrogen positive breast cancer, things like that. Certainly at various points. There are thoughts about women that are removed from breast cancer far enough that maybe hormones would be safe again. But I'll tell you, as a doctor, it's really tricky to want to write that prescription. You really don't want to fan the flames on anything. And yet, we know that sexual activity is so important for a healthy life because you're releasing all that oxytocin, that hormone that gets released with sexual intercourse, breastfeeding, kissing, hugging, things like that. Intimacy is such a big driver of oxytocin, which is such a big driver of longevity benefits. So being able to allow people to reclaim that seems like a massively positive thing. That's very, very cool.
And for those, it's interesting with women, I think one of the most challenging parts for the introduction of the V is that women don't like to talk about that. They just feel like any talk about vulva, vaginal, it's a reflection of who they are. So they're like, I'm good. I mean, when the fact of the matter is, if you're aging on your face, you're aging down there. So if you're doing something about this, why not do something about that? And that is about quality of life. It's about connection with not only yourself, but connection with your partner. So I just, but the second thing too about the CO2 Lift V is that it's been very helpful with stress incontinence, which more women get excited about that than having better sex, surprisingly. Having to cough and not pee. It's something that in our last clinical, we were really, really, really happy. And we added it to this particular clinicals just simply for the fact that we had so many women expressing, including myself, that, you can run and not have to, have on a panty liner. You know what I'm saying?
Right.
So that is a benefit of the CO2 Lift V.
Yeah, that's really wonderful. I mean, that's fantastic. Yeah, I know that stress incontinence is a big thing. People cough, they laugh, they go for a run, they strain. Could be almost anything. Picking something up could be almost anything, right? That puts that extra stress. It's kind of like a Valsalva, where you crunch down, like you're moving your bowels almost in it, right? So, yeah, that's really fascinating. Now let's switch gears and let's talk about men for a second. So, what are you noticing with men? You ran a trial for women only, or men and women, or how did that go?
It's so funny how life is. So for the trial for women, of course, we had to pay. With the men, the urologists who reach for women, we had to pay. The urologists who reach out, they're like, you don't need to pay me anything. just give me some products to try. Because what we did was a pilot study. And what they found is that the shim score, so 5 to 12 points difference by using 5 CO2 lifts.
Wow.
That was a nice result. And they found that they have to repeat it within 6 to 8 months. But to have, stronger, nicer erections. But I think in addition to that, the skin, just like because it's quality of skin. So you're talking about the testes, you're talking about just the skin down there, just smoother, nicer looking, just anatomy. It's appealing, but more important to the functionality. And again, it's related to blood flow. So we're actually just doing now, we have 2 urologists who are doing a study. One of them is comparing the CO2 lift to CO2 carboxy with the needle, which I think is kind of painful. So they're doing 30 men, 15 with the needle, 15 with the CO2 lift. And then the other one is they're just doing a blind study with an ultrasound gel. We promised the men that who don't get the real thing, that they'll get the real thing, because it was very hard for them to get men to sign up for a study when they're not going to even see anything.
When they're not going to get the real thing.
Yes.
So let's just talk about the SHIM score for a second, just so the audience understands this. So this is basically a score of erectile dysfunction, and it's on a scale of 1 to 25. So 1 to 7 would be severe erectile dysfunction, 8 to 11 would be moderate, 12 to 16 would be mild to moderate, 17 to 21 would be mild, and 22 to 25 would be, no signs of any erectile dysfunction. So what you were just saying was that using the CO2 lift, and how many times did they use it?
5. So 5 days in a row.
5 days in a row. Okay, so this was a 5 days in a row. So they used it 5 days in a row, and again, it's the same 45 minutes that it's applied for?
Yes, correct. Mm-hmm.
Okay. And it improved the SHIM score by how much again?
I mean, anywhere between 5 to 10 points.
5 to 10 points.
Yes.
Okay. So on a scale from 1 to 25, 5 to 10 points, that's a potentially significant, whoever you are, that would be a significant improvement.
Yes.
And I suspect that the more severe somebody was, maybe the, 5 points there represents an impact. Did you find that the people that had milder ED had the bigger impact, or was it the other way around, or what did you see there?
They had the bigger impact. The ones with mild to
one
moderate.
with milder ED.
Yes, correct.
Had the biggest impact. Okay.
Yes.
Yeah, that's really interesting, because if you, like anything in medicine, if you get to it earlier, right, it's better. And so, yeah, this could be good. I'm thinking of some people that may benefit from this, actually. I have some clients that have gone through certain things, either procedures or whatever else, right, where they're trying to reclaim all of the erectile function that they once had.
Yeah.
And certainly as men age also. We have lots of ways to improve erectile dysfunction with regards to improving arterial glycocalyx, which basically is the little, what's it like? Let me describe it. It's kind of like the weeds in the bottom of a river. It kind of measures blood flow and then causes the artery to release nitric oxide. And then, of course, when somebody is aroused, the nervous system causes the arteries to release nitric oxide. And so we have ways to increase your ability to have more nitric oxide. We've done podcasts on nitric oxide with Nathan Bryan and things like that. So, but now what's happening here is it sounds like this is also improving that. And it sounds like there's also a structural element to this also, because we've seen the structural elements in the vulva, vagina, the face, things like that. So you're probably improving not only blood flow, but tissue and, as you said, some of these other things. I think that's fascinating. Did the men report any difference in the quality of their orgasms as the women did?
No, we didn't. You know what? No, we didn't even touch on that part. In fact, one of the things we use, the men, by the way, they turned their face because we're seeing their penis. They reported they just turned their face. We couldn't see, but they expressed even just better masturbation. Like they enjoyed touching themselves better. I mean, so I don't know what that equates to.
Greater sensation is what
greater
you're saying.
Sensation. Yeah. Yes.
Greater sensation. But you never asked anybody if they had a better orgasm?
No, because our focus is really on women. We just had we have a lot of male doctors that they just took upon themselves. If this is working for women for blood flow, let's try it.
So let me try this. Okay,
yeah.
Got it. Mm-hmm. Well, it's fascinating. That's really cool. So we're talking about face, we're talking about skin in general, it sounds like. And then we're talking about really sexual function as well as sexual enjoyment, which is a big deal. Are there other applications that you see for it?
That's pretty much it right now. I mean, we're doing a thing on hair. I'm really curious to see. In fact, I was in Newport Beach last week, and one of the doctors who does a lot of hair studies, before we invest in a hair study, they're just measuring the blood flow to the scalp with the introduction of the CO2 lift to the hair follicle. So that would be an interesting one. We've tried it. I mean, we know some doctors, some dermatologists who are using it with PRP, because even when you put it on the face, put PRP, it just helps better. It's a delivery
Nice.
system. CO2 is a great delivery system.
Yeah.
So using it as a standalone, I'll be curious to see how it works. I mean, I know with hair transplants, it's great because again, it's going to help to repair, just heal in the healing. But that will be a great project. If we can get some great numbers on that, we're definitely going to pursue that as well.
Well, let me ask you this. You talked about it goes on for 45 minutes and then you're peeling it off. Is it the kind of thing where you stand there for 30 minutes trying to peel it off, or does it just come off in one big mask?
It comes off in one. Yeah, it comes off in one. Our Instagram is great. People love to peel it off and you can see it. It comes off in one big clump. For the hair, you just basically stand in the shower and once it gets wet again, it turns back into jelly. So it comes out very easily. Even with long hair, it comes out very easily. So that's not a problem with that.
That was going to be my question about my beard and the hair.
Mm-hmm.
Yeah.
My son, I mean, I know we market this for guys who are growing a beard. We have the derma roller system, and then of course putting the CO2 lift on top, just again with blood flow and so on. So again, this hair study would be a great thing. I think hair is a big topic for so many people. And then it's really what has been in the last 20 years. Nothing is new on the market for that. So this would be great to be used and it's simple.
What's interesting to me about this is the fact that you're not having to use it very often, right? I think people will find that appealing. Like for the men and for the women, for the vulva, vagina, was that 5 days also like the men?
It was 10. So the 10. loading dose as a standalone is 10. So 10, within 2 weeks doing 10. But it's a nice feeling, So when you apply it, it's very cool. Right. It's a very nice feeling inside. So and then you can just put on a panty liner, go to bed, wake up in the morning, go on the toilet, pee it out. Yeah.
Interesting. Very, very cool. All right. Well, good. We'll send us some. We'll be happy to test it out.
Yeah.
We'll report back. Yeah. So where can people find this? Where do they find this?
They can find it. Well, they can go from their doctor. The doctors have a version called the CO2 Lift Pro. We have the V, which is the same product we carry on our website, co2lift.com, which, by the way, I didn't even talk to you, Dr. Gladden and Steve. If you're interested in some type of discount code for your audience, we would be happy to do that. Maybe
we'd love that.
Gladden 15, and we can set that up for you.
Gladden 15. Yeah, great. The audience would love that, so they can try it.
To try it. And of course, I'll send you some for you to try. But the co2lift.com is where they would find the CO2 Lift, the CO2 Lift V, or they can also ask their provider, their skincare provider, their gynecologist, soon to be urologist carrying the product as well. But either of those ways. I welcome questions through my Instagram as well. So if people want, I'm very good at responding. And my team is great at responding to their Instagram.
So I'm getting the feeling that this is carried in physicians' offices as a major modality. And then it's also available to the public directly. Is that correct?
Correct.
Or
that's correct.
Do they have to go through their doctor? Yeah.
No, that's correct. Yes. Mm-hmm.
Nice. Well, that's great. Steve, do you have any other questions?
No, I'm really interested in trying this out and seeing how it comes out of my beard and seeing how my face looks afterwards.
Yeah, exactly.
Sure. We'll send for both. Just send me the address and we'll get you guys hooked on it.
Yeah, I'll send it. I'll have Leo send you my address in Dallas.
Lana, in the show prep we got from our producer, Leo, one of the things that was addressed in here was how to address clitoral atrophy. What the hell is clitoral atrophy?
Oh.
Well, it's well, like anything else, I mean, we kind of talked a little bit about it, is that the clitoris, for it to function correctly, needs blood flow. And really, when does aging typically start? Around 25 is typically the age when things start to slow down. You look at a woman's face, and she's 25, it looks really nice. But when you look with a microscope or, you'll see the fine lines that if untreated become deeper. Well, the clitoris too, the blood flow slows down. And it's like, think of a man would never have sex with a flaccid penis, right? But many women are having sex with a flaccid clitoris. It's just not getting engorged enough. And so the CO2 Lift, what it's doing, because one of the biggest things about it is increasing blood flow. It's bringing the blood flow up. So it's keeping it healthy. So it's almost like a woman is staying at a simmer. So, so that when she turns on the fire, she can boil easily, right? So it prevents the clitoris from drying up.
Yeah, it would shrink on one level because it's losing collagen like skin would, but it would lose its ability to expand because of the decreased blood flow coming into it, right? So
Correct.
It sounds like this technology is addressing both of those elements, which is novel, quite honestly, because we have ways to address blood flow, but we don't have ways to address the quote-unquote atrophy or loss of tissue mass, right? So that's interesting. Cool.
Correct. I'll be in Dallas, by the way, in March.
Oh, really?
Yeah, there's Rod Rorick. I don't know if you know him. He's a plastic surgeon. There's a meeting there I'm attending. So
okay, good. Well, I may be there. So yeah.
Okay.
If not, you can definitely swing by the office and take a look and talk with the team.
I would love to. I would love to.
That's awesome. Okay, well, great. Well, thank you so much, Lana, for taking the time to talk with us. It's a really fascinating technology. I think the audience will be very interested in this. So it's all about living
really
young
good,
for
by
life.
the way. Dr. Gladden, I love your style. I love your style. I love how direct you are. I love it. So thanks for having me.
My pleasure. Thank you. Great conversation.
Thank you for listening to this week's episode of the Gladden Longevity Podcast. If you would like more information on what we've discussed or other topics, please reference the show notes or go to gladdenlongevitypodcast.com. You can also find us on Instagram, Facebook, and Twitter by searching Gladden Longevity. If you've enjoyed this podcast, please subscribe to get future episodes delivered to you and share our podcast or this episode with someone in your life that you may find benefit. Thank you for listening. We'll be back next week with another exciting episode. The Gladden Longevity Podcast is provided for informational purposes only. It does not constitute medical advice. This content is not intended to be a substitute for professional medical advice, diagnosis, or treatment. Always seek the advice of a physician or other qualified health provider with any questions you may have regarding a medical condition. The use of any information and materials linked to this podcast is at the listener's own risk.